You're listening to Health Professional Radio with Wayne Buckler. Today, my guest is Andrew Lemon of the Functional Movement Group. Andrew is joining us to tell us what the group does and where they fit into the health industry. Hello to you, Andrew.
Hi there, Wayne. Thanks for having me.
A pleasure. Now, Andrew, tell us about the Functional Movement Group. What are their products and services?
Sure. Well, Wayne, the Functional Movement Group are professional development providers for healthcare professionals, and we're also clinical product innovators and the inventors of the movement assessment tool. So we provide a range of different courses that really focus on functional movement, and so looking at an active approach to treatment for healthcare professionals and therapists, and also looking at better measurement of movement itself using the movement assessment tool.
Now, Andrew, you're based in Melbourne, but what geographic footprint do you service?
Well, Wayne, our courses, we're obviously, as you say, mostly in Melbourne, and that's where we practice, because we do also have to work as therapists ourselves, myself and co-director Stephen King. But we run our courses all across Australia, so all up and down the East Coast and making our way across to Adelaide and Western Australia as well. But we're also running courses in New Zealand too.
I see. Do you notice much difference between New Zealand and Australia?
There's a little bit of a difference in terms of some of the osteopaths that we've worked with there, but realistically, all therapists are there trying to do the same job as best they can, and that's help their patients.
One of the nice things about the human body is it's just one model all around the world, really, isn't it?
Well, that's right, but certainly there's a need to be able to understand the individual and being able to look at a person as an individual, particularly when it comes to the way that they move, because we all are a little bit different in that regard, and that's where we find some of our stuff in terms of being able to better understand movement and being able to measure it a bit better with the movement assessment tool, or the M.A.T, really comes in handy.
Now, Andrew, explain this movement assessment tool to me.
Sure. So the movement assessment tool, or the M.A.T as we like to call it, it really came out of a need to be able to better quantify and measure movement. What we found was that we weren't too bad at looking at the quality of movement, being able to look at someone and say whether or not we thought they were moving well or moving poorly, but we really struggled to be able to put a number on things. And when we looked out into the market at what was available already, a lot of the things that were there were quite big, quite cumbersome, and maybe a little bit harder to use in terms of the tool. So what we decided was that we needed to develop something that we could use to be able to put a measurement on movement and be able to quantify it, but do so in a way that was easy to use and convenient for practitioners, particularly in Australia, because in Australia, we really find that a lot of clinicians and a lot of practice have quite small clinical treatment bases. So we needed something that was small and easy to use as well. So what we developed was a tool that it's a rubber mat, similar to something that you might find in a yoga studio or something like that. Mm-hmm. And it's got a lot of markings printed on it. And what that does is it allows us to measure things like distance in movement. We can also measure angulations in movement. And then even using a foldable ruler that comes with the movement assessment tool, we can even measure the verticalities. And what that allows us to do is really set a baseline for movement data. And we find this particularly handy for when health professionals encounter a patient for the first time. You can really give them a bit of a profile on where they're at the first time you see them. So being able to provide some really good information on that initial screen that a lot of healthcare professionals will perform.
I see.
From there, what that allows us to do is really track a patient's progression as well, because once we have that initial data, we can really see, okay, well, how's our intervention in terms of treatment or rehabilitative training, things like that. How is it actually progressing this patient? And we find that that's really handy, not only for the practitioner, but it's good for the patient as well to be able to see how they're tracking along, and allows them to see whether or not they are improving, and probably improves that buy-in into the treatment too, which is really important for someone's progression.
You're listening to Wayne Buckler on Health Professional Radio, and I've been in conversation with Andrew Lemon, the Director of the Functional Movement Group. Andrew's been telling us about the movement assessment tool that they've released into the market. Now, Andrew, you also run a lot of clinical training courses. Tell us about that.
So we have two course offerings at the moment, Wayne, that we offer to a range of healthcare professionals. So we see a lot of physiotherapists, a lot of osteopaths, but other professionals that particularly work hands-on with their patients. And we even see people involved in the strength and conditioning and the fitness industry as well. But the courses that we offer are, first and foremost, we have our M.A.T course, which once again looks at how we can use the movement assessment tool in practice, and particularly focuses on some key assessment ideas, ranging from looking at how we can assess the lower limb, moving up through the spine, and even into how the shoulder functions and works as well. So that's a one-day course that really goes into great depth and detail on how you can use the movement assessment tool, and gives you a great basis for functional movement assessment that can be used the next day with any patient that you see. After that, we have another course offering called Function 101, and this really goes into even more depth at looking at movement assessment, as well as how you can use that active movement and training approach to your actual treatment with a patient or with a client. So it gets pretty clinical with how we can look at those movement ideas, and that's about developing movement variability in all three planes of motion. But also it goes into a bit of depth on how neuroscience can even affect how we move, and even how pain can influence some of these things as well. So we find it particularly useful for anyone that deals with chronic pain type patients as well.
Now, Andrew, for people who want more information about this, what's the website they can go to?
Well, Wayne, they should go to www.functionalmovementgroup.com, and from there they can get plenty of information on the movement assessment tool, or the M.A.T, as well as our course offerings and any of the future courses and education opportunities that we may provide. I should also mention that for anyone that goes to that website, if you sign up to our newsletter, we have a free screening documentation. That's a downloadable PDF file, and that goes through some great key movements that can be used either with a M.A.T, or it can even be used without the M.A.T itself. But they're all tests that are really backed well in the literature, and could give any health professional some better ideas on how they can use movement assessment as part of their practice.
It sounds like a valuable tool. Andrew, what's the greatest misconception about your products and services that drives you nuts and keeps you awake at night?
Well, I think that's a pretty good question, Wayne. It's probably the biggest issue that we have is what's in our name itself, and that's functional movement. I think in the current world of health and fitness, functional movement is probably considered to be something that's more based on certain tools or techniques in the industry. So often people think about balancing on one leg, or standing on a Bosu ball or a wobble board, maybe using something like a kettlebell or a medicine ball to actually perform exercise or movement. Mm-hmm. And I guess the problem is that it's not really a case of the tool or the technique. It's really, it should be something that's more around the understanding behind the movement that should make it either functional or non-functional for an individual. So for us, our consideration is that a functional movement is one that has real meaning for that person who's performing it as part of their training. So it needs to be something that's actually based on whatever their wants, their needs, and their goals are that they want to be able to achieve when it comes to movement. And so that's where we feel that we provide some really great understanding in terms of how this works for an individual. So looking at how an individual moves and being able to interpret through the use of principles and strategies of movement, whether or not this is something that is actually functional for that person and is going to actually help them progress to where they want or need to get to. So that's probably the thing that drives us a bit crazy, in that people maybe don't consider that when they think about functional movement in itself.
Andrew, it's been a pleasure to talk with you this morning, and for people who need more information, the functionalmovementgroup.com website is the place to go. We'll have a transcript of this interview and an audio sound archive of it at our website on www.healthprofessionalradio.com.au. My name is Wayne Buckler. You've been listening to Health Professional Radio.